Hi, I am Dr. Leela Mohan PVR. I had done my MBBS MD. I am general medicine physician. I practice at Motherhood and Rainbow Hospital, Sajapur Road. I have my own center called as Padithem Healthcare, that is in HSR layout, Bangalore. Dengue fever. So what is this dengue fever? Dengue is mainly transmitted by the virus. The mosquito bite causes the transmission of the virus. The virus, which is called as flaviviridae, there are different serotypes antigenically which are similar, that is DEN1, DEN2, DEN3 and DEN4. These are the certain viruses which cause the dengue fever. So the virus is mainly transmitted from the mosquito to the person. Certain mosquitoes called as Aedes Egypti, which is a female mosquito. It causes the transmission of the virus during the daytime bite, and there is another mosquito called as Aedes albopticus which also transmits the dengue virus. So what happens when someone gets this dengue? The incubation period is nothing but the starting of the virus to show the symptoms will take 4 to 5 days, where the virus incorporation and the person will develop fever, headache, nausea and vomiting, mild abdomen discomfort, or some people may have loose stools, easy fatigability, generalized weakness, tiredness, or the main symptoms where we have to look in this incubation period. So dengue fever is mainly 3 types, like you get mild dengue or moderate dengue or severe dengue. The mild dengue consists of the temperatures which will go or increases above 101. The person will have weakness and tiredness, and the person can also develop joint pains, and the muscle pulls are nothing but easy fatigability, and then as I already told, nausea or vomiting sensation, headache they can get, and pain behind the eyes, and then mild gum bleeding, or when they brush the teeth they can see the blood, or sometimes the nasal discharge where the blood can flow through the nose, and then a person when pass the urine they can see the red colored urine or orange colored urine, which suspects that there is increased chances of dengue, which is getting progress to the moderate dengue, and it can lead to dengue hemorrhagic fever, or will also called as dengue shock syndrome. In severe cases, that means after a few days the person can develop breathlessness. Literally the patient or the person will feel difficulty to take breath, and bleeding through the gums, and then the person will develop itching and rashes all over the body, where it suggests that the platelet count is getting reduced lesser than the normal. The normal values of the platelets are from 1,50,000 to 4,50,000, but due to this viral impact the platelet count falls, and they can go into the dengue shock syndrome. Severe abdominal pain, and they also develop loose motions, which is very severe, and it causes dehydration and the fall in blood pressure. So how do we identify this dengue? Mainly the clinical evaluation. You have to go to your doctor or any healthcare professional surrounding you. They will do a blood test. There are certain tests which we call it as RTPCR, that is Polymerase Chain reaction tests, and there are card methods which will help in detecting the dengue virus very easily. So there are dengue tests which includes dengue NS1 antigen, and there is called as IgG and IgM antibodies. Any one of them comes as positive in your blood report, definitely it is dengue positive. So IgM and IgG are antibodies which are formed against the dengue virus in your body, and the NS1 antigen test is mainly directly to check the presence of virus or not in your body. So the dengue tests, again one of the tests include CBC, that is called as complete blood count, which includes your hemoglobin levels, WBC count, like neutrophils, eosinophils, lymphocytes, and mainly the platelets. In the dengue virus, as I already told, the platelet counts will be reduced, which has to be monitored every day. You have to go to the doctor or call a lab person who will check your platelet count. So how do we take measures to prevent this? Definitely the vector has to be prevented. Vector is nothing but mosquito. We have to spray mosquito repellents, and then we should not allow the stagnant water accumulated anywhere surrounding your areas where you are living, and you should not allow the dust and the waste material should not get pile up on the roads or next to you. There are many trees or bushes that has to be cleared properly. The main concept is we have to avoid the mosquito bite, and then mosquito bite getting avoided, you can use the mosquito repellents at home, and then you can use mosquito nets, and nowadays there are which are gels or ointments, what we'll call it as. These can be applied over your skin, always definitely help in preventing the mosquito bite. So the treatment mainly includes the fluid replacement. Fluid replacement is nothing but the person should be consuming at least 2 to 3 liters of water in a day, mainly to prevent the complications or dehydration, and consuming a lot of fruits like kiwi fruit, pomegranate, papaya, and berries. You can have even strawberries, dragon fruit, blueberries. Always helps in increasing your antioxidant levels and your immunity. That is one of the treatment. And then the other treatment is using a drug called as paracetamol, that is acetaminophen, which will helps in reducing the fever, and other drugs called as NSAIDs, that is called as non-steroidal anti-inflammatory drugs, which also helps in reducing the fever. And then the direct treatment is platelet transfusion, that will be done in the hospital once your platelet count is getting decreased less than 40,000 or 30,000. And then even if you have complications such as headache, severe weakness, tiredness where you cannot get up from the bed, all those things will definitely require the platelet transfusion and the hospital admission. Regarding the vaccine, definitely vaccine is available only at particular places, not everywhere. If you are traveling to that places, the dengue vaccine can be given by them. So it is not available everywhere.